is Chloe, and this is for my ophthalmic medication administration video. I'm in course BSN 225, section 9. I am in my uniform with my badge, and I don't have any jewelry or nails on. So for our skill today, we're going to be using our patient, 2 cloths, a pair of clean gloves, and our medication right here, sorry. I did get my skills kit and they didn't give me eye drops. It's missing from my kit, so I'm just using this from home just to improvise for the video. So also I just want to say I apologize for my setup because we just moved into a new house, so this is all I have right now for a table. So the first thing that we want to do is we want to go ahead and check the patient order. Once we've done that, we want to go ahead and go over the 6 patient medication rights. Those are right patient, right route, right time, right dose, right medication, right time, and then right documentation. Then we're going to go ahead and look at the EHR and go over the medication that we're administering. So at this point, we would do a dosage calculation, but in this case, they already provided that with us. So today we're going to be administering Timelo 0.25% solution, 1 drop in each eye 2 times a day. Once we go over that information, we're going to go ahead and go into the patient's room. Okay, so I'm going to knock on the door. Hello, my name is Chloe. I'm going to be your nurse today. I'm going to go ahead and close the curtain for privacy. Before we start anything, we want to make sure that if there's any family or visitors in the room, that we make sure that with the patient that they're okay with them staying, or if they need to leave, so that we are continuing to do our HIPAA. Once we do that, then I'm going to go ahead and ask for patient identifications. So hello, Miss Smith, can you please state your name and date of birth, please? Okay, thank you. I'm just going to double check the wristband. Looks good. Now with that information, I'm going to go ahead and check the order and make sure that it's matching, and that will be my 2 identification factors, okay? Then I'm going to ask the patient if they have any allergies. Miss Smith, do you have any allergies that we need to be aware of? Any food allergies, medication, anything that we need to be aware of today? No? Okay, great. So once we do that, then we're going to go ahead and go over the medication with them and why we're here. So your doctor has prescribed that we administer Timelo, which is eye drops, and this medication helps with decreasing pressure within your eye. There are some side effects that can happen, and that can be anything like dizziness, blurred vision, swelling in the eyes, pain in the eyes, sometimes infections in some cases. If you do experience any of those, then please let us know. We want to help you. And then there also could be some adverse reactions, which could include difficulty breathing, chest pain, headache, heartburn, anything like that as well. Please let us know immediately. And then I also just want to let you know that when administering the medication, there can sometimes be a burning sensation or a stinging sensation. So if there's any pain or discomfort, then please let me know as well, okay? So some patients want to administer eye drops on their own. That's totally fine as long as the nurse is present and watching. So if they want to do that, then that's okay. So we also want to let them know that sometimes when doing the eye drops, there can be temporarily blurred vision and sometimes temporarily colors or light sensation, sorry. So sometimes there's like you're sensitive to light, which it's only temporary, it should go away, okay? So now that we've gone over that information, I'm gonna go ahead and make sure that the patient has no questions, and if they do, then answer them, okay? Ms. Smith, do you have any questions today for me or concerns about the medication that we're gonna be administering? No? Okay, great. So next I'm gonna go ahead and wash my hands and then apply a pair of clean gloves. So the first thing that we want to do is we want to make sure that the patient is in a supine position or sitting up with their neck slightly hyperextended, okay? Let me see right here. Okay, so first we are gonna go ahead and clean the eye. Sorry, you can't see me. We want to go ahead and clean the eye. We want to look for any drainage, any crust that we want to get rid of before administering the medication, okay? So we're gonna go ahead and get our clean cloth, and we're just gonna go ahead and wipe along the eyelid, going from the inner canthus to the outer canthus. Then using a clean swap for the other side as well, inner to outer. And in some cases, if the patient has a lot of crust or drainage that we aren't able to get away with this, then we're gonna go ahead and get a warm rag or cotton ball and apply it to the eye for several minutes until it's gone and ready to do the medication, okay? So once we've done that and the patient is ready to go, I would then remove my gloves and wash my hands again. In this case, I'm not gonna remove them just because this is my only pair of gloves. So I would wash my hands and then remove my pair of gloves, okay? So Ms. Smith, we're gonna go ahead and administer the medication now. Do you have any questions before we start? No? Okay. So we're gonna be using our other clean cloth, and we want to go ahead and hold pressure, not too much pressure, but just slight pressure along the cheekbone, okay? And we want to go ahead and expose the conjunctival sac. Once we've done that, we want to go ahead and lightly place our wrists onto their forehead. And once it's exposed, we're gonna go ahead and hold the drops 1 to 2 centimeters above the conjunctival sac, okay? We're gonna ask the patient to look up. Ms. Smith, can you please look up for me? I'm gonna go ahead and administer the drops, okay? So once we have that patient looking up, we're gonna go ahead and administer the prescribed dosage for the drops, which is 1 drop per eye, okay? So 1, and again, I'm not taking off the red cap just because this is an actual medication, and we just don't want it to get everywhere. Okay, so once we've done that, then we're gonna go ahead and get another clean part of the rag and go to the other side, doing the same thing, lightly pressing against the cheekbone, exposing the conjunctival sac with our non-dominant hand and using our dominant hand to go ahead and do this. Ms. Smith, can you please look up for me? Administer the dosage. Okay. And we also want to make sure that if the patient blinks or closes their eyes to where we weren't able to administer the medication, then we'd want to redo the procedure, okay? And then also, when administering drops that have systemic effects, we want to make sure that we apply pressure to the nasal subcomal for 30 to 60 seconds. But in this case, we don't need to do that. So after that, we are done. We are gonna go ahead and clean up my workspace, take off my gloves, dispose of them, wash my hands, and make sure that the patient is comfortable. Ask them if they're feeling any pain or discomfort. Ms. Smith, are you feeling okay? Is there any discomfort in your eyes from the medication? No? Okay. Just remember, if you do start to have any effects, then please let us know, okay? I have your call button, and then I'd go ahead and document the care now, okay? Thank you.